Hi, Brian Schwager here, founder of the Wellness Movement Center. Today I want to talk a little bit about the difference between working out and working in. I work with a variety of different clients, ranging from the semi-professional athlete to the recreational athlete to general fitness, and then of course I work with people who have health and muscle and joint problems. And there's a way to design programs where you can receive the most benefit. So like with my high-level athletes, when they have gone through the assessment and they've cleared the protocols, they are geared, and those people are geared to work out at high-intensity levels because science has shown that high-intensity interval training and high-intensity exercise really increases lean muscle tissue response, cardiovascular efficiency, and actually strengthens the blood vessels that help your heart to pump. However, those who have complications, which are the majority of the people that come and see me, I still want them to move, and I still want to restore their posture and bring around ligamentous strength and stability, but we want to do it in a way where I don't exhaust the body, because exercise in and of itself is stressful. And when the body is overstressed, we don't want to add more to the pie. In other words, we don't want to add more stress to the body's organism system. The two most important systems in the body to restore are the nervous system and the hormonal system. In athletics, the two most important parts of the body or systems of the body to enhance is the nervous system and the hormonal system for the continuous growth and rebuilding. When we're exhausted, we're in a catabolic state, we're breaking down. So what we want to do is we want to exercise carefully and precisely that will rejuvenate the systems and bring us back to a point where we can get back into more of a workout routine. Workout means to expend energy. Work in means to cultivate and restore and replenish energy. So in a minute I'm going to show you some exercises that are really good for restoring various systems of the body, whether it be meaning the organ systems, but also the muscles and bones. All right, so working out versus working in. How do you rate? Well, the only way you're going to know is by having an assessment done, and then we can rate and rank your wellness and your movement and see what part of the continuum you're on, because we always want to be moving towards wellness. So the first place to start is to make sure your breathing is regulated effectively for the rejuvenation and replenishing of your systems, your organs and your nervous system. Diaphragmatic breathing, you can look it up online and find many different methods, but very simply, I breathe in and out through my nostrils, driving the air down into the abdominal region. So when breathing in, I inhale and then fill up the bottom half where the lobes of the diaphragm fit down in this area here, fill that up first, and then expand the ribs and the chest last. So from the side, it is expanding outward, expanding down, so long, so you're breathing into your abdominals, and then expanding wide. But also lastly, don't forget to expand the rib cage area. We need to loosen that up and take the pressure off the organs. 4 to 5 seconds in, and then twice as long on the way out. Now you want to remember that when you're breathing diaphragmatically, you do not want to use your chest, your upper chest, or your neck muscles. Keep those relaxed and breathe down below and as high as your chest and rib cage second. Your breath, keeping your mind away from the future events, and definitely keeping your mind away from what's happened in the past and staying present. I also want to mention a little bit about posture when you're breathing. You want to be upright, in good posture, whether you're sitting or you're standing and doing these exercises. Make sure you're in an upright posture. There's many reasons why that's a benefit, but I'm just going to say maintain good posture as you're doing your breathing. You want to do it in an environment where you're not being disturbed, or if you really think about it, they can be done anywhere. In a waiting room at a doctor's office, waiting at the red light, and whenever you're experiencing a lot of stress, you want to stop, breathe, center, and then proceed forward. So that'll help to calm the system down. There are some of the tools that I teach my clients in everyday life, because you never know when emotional stress is going to enter your field of energy. All right. We don't want any exercises in a work-in program to raise your heart rate or to labor your breathing, because at that point it turns into a workout exercise. Okay, so the first exercise is called a pelvic rock. If you don't know what a pelvic tilt is, a pelvic tilt is where you're rotating your pelvis back towards the floor and your back is flattening against the floor. That's the tilt part. And then the opposite is when you rotate your pelvis forward and you're creating a little arch underneath your low back. Now, the palms are up, the shoulders and neck are relaxed, and what you're going to do is you're going to synchronize the tilt, or the flattening of the back, with an exhale. And then you're going to couple that with an inhale as you slowly arch your back off the floor. And again, I add the diaphragmatic breathing in the inhale or the arch as an added bonus. Another exercise I like is called the leg tuck, and it's simply bringing the legs up. You see how the knees are apart? Grab behind the legs by the hamstrings, exhale, and just pull the knees towards the chest. And then inhale, keeping your back flat, and if you need to, you can assist your legs depending on the nature of your health challenge. You can assist your legs until your feet hit the floor. And then you repeat, exhale. These couple of exercises will help to rejuvenate and replenish the systems of the body. The breathing pace, making sure that we're not laboring our breathing, making sure our heart rate isn't going up. Because when that begins to happen, we are going into a workout exercise. I pride myself, based on the assessments, again, I do a full comprehensive assessment to determine not only what types of exercises I need to do to enhance that client's abilities, but also to create an exercise program that doesn't make it worse. All right, I hope you get something out of this. Try these exercises again. Be very careful if they cause pain or discomfort. You don't want to do anything that causes pain. And get assessed. Look at finding somebody in your area, or if you live in my area, give me a call and we'll talk about how we can design a program to rejuvenate, replenish, and rebuild your body. I'm Brian Schwager, the founder of the Wellness Movement Center, here to help you move well through life. Thank you.